Hello, welcome to my YouTube channel. Our presentation today is on STI, Sexually Transmitted Infection, or STD, Sexually Transmitted Diseases. We are breaking the silence, STD awareness and education for a safer tomorrow. In this presentation, we will be looking at what is STD, what causes STDs, who's at risk, general symptoms of STDs, what are the signs that shows I must have an STD, diagnosis, treatment options for common STDs, complications of STD, and how can I protect myself from getting STD. Sexually transmitted diseases are infections that can be transmitted through sexual contact with an infected individual. These are also termed as sexually transmitted infections. STDs can be transmitted during vaginal or other types of sexual intercourse, including oral and anal sex, but some are acquired simply by skin-to-skin contact. Now let's look at what causes STDs. STDs can be caused by over 20 different types of organisms. First, we have viruses, and viruses causes infections such as HIV, hepatitis B, herpes simplex virus, and human papilloma virus. We have bacteria, and they cause infections as gonorrhea, chlamydia, and syphilis. Another organism that causes STI are the parasites and causes infections like trichomoniasis, and also fungal infections like candidiasis. There are many types of STDs. Some of the common STDs are chlamydia, gonorrhea, herpes simplex virus, HIV, hepatitis B, and syphilis. Many of these STDs do not show symptoms for a long time, but they can still be harmful and pass on during sex. Risk factors for STI. Both males and females are at equal risk for STD, but the complications are often more serious for women. The primary risk factors for an STD is unprotected sexual intercourse. It is important to note that most people with STD do not have any symptoms. The highest risk is for certain groups, which include those with multiple sexual partners or whose partners have sex with multiple others. Also, individuals in a non-monogamous relationship who do not use condoms during sex with their partners are also at risk. Still on who's at risk, people with history of STI, commercial sex workers, drug abusers, especially those who drink and use injectable drugs, because they tend to practice high-risk sexual behavior. Young people, who account for 50% of all cases of STDs. Men on drugs for erectile dysfunction, and also mothers who are infected stand a chance of transmitting the infection to their children, either through birth or breastfeeding. Signs and symptoms of STDs. The symptoms of STDs vary with the type of infection, but they commonly include discharges from the penis or vagina, itching around the genitals, pain experienced during sexual intercourse or while urinating, and also there may be blisters around the genital area. Keep in mind that depending on the type of infection, STD symptoms may show soon after exposure or within a few days, or may take years for the symptoms to show. Now let's look at the common signs and symptoms in these following STIs. Symptoms of chlamydia can include vaginal discharges in women, penis discharge in men, and burning sensation during urination in men and women. Gonorrhea can cause thick, cloudy, or bloody discharges from the vagina or urethra, and pain or burning when peeing. If you have gonorrhea in your anus, it may cause itching in and around the anus, discharging from the anus, and pain when defecating. Gonorrhea in the throat may cause sore throat. Acute hepatitis B can cause fever, fatigue, loss of appetite, nausea or vomiting, abdominal pain, dark urine, clay-colored bowel movement, joint pain, and jaundice. Symptoms can appear anywhere from 6 weeks to 6 months following exposure to the hepatitis B virus. Signs of genital herpes typically include red bumps that develop into blister-like sores in the genital area and sometimes on the buttocks or thigh. Symptoms of oral herpes can include itching of the mouth or lips, sores or blister on the lips or inside the mouth, and flu-like symptoms. Early symptoms of HIV infection can resemble those of the flu: fever, headache, muscle aches, and sore throat. They may also include swollen lymph nodes, diarrhea, nausea, and vomiting, a fungal infection of the mouth, and a rash on the abdomen, arms, legs, or face. If HIV goes untreated, later symptoms can include fatigue, weight loss, night sweat, joint pain, short-term memory loss, and recurrent infections. Most strains of human papillomavirus cause no symptoms and are detected only after abnormal cells are discovered during a pap smear. However, some types of HPV cause genital warts, which appear as skin-colored or whitish growth on the genitals or anus. Scabies symptoms include intense itching that is typically worse at night, and also it can cause small red bumps or a rash and raised lines on the skin. In the primary stage, syphilis causes a painless sore or ulcer at the location the bacteria enter the body, often in the genital area. In the secondary stage of syphilis, a rash may occur on the body. Someone will ask, can I have an STD and not know? The answer is yes. Many STDs don't cause any symptoms, especially during the early stages. So the only way to know for sure if you have one is to get tested. Keep in mind that you can get an STD from having sex with someone who has no symptoms and may not know they have an STD. Diagnosis, or when and how often should I get tested? Women should be tested for chlamydia on a regular basis. Testing for chlamydia, gonorrhea, and trich involves collecting either a urine sample or a swab from the vulva, vagina, and penis. For other STDs, including HIV, syphilis, and the genital herpes, blood testing is most accurate. To test for human papillomavirus, a sample of cervical or anal cells must be collected. How often an individual needs to be tested for STDs depends on their level of risk for infection. Still on diagnosis, individuals with high-risk sexual behavior or STD symptoms need to be screened for STDs. Treatment options for common STDs. Some STDs are curable with medical treatment, while others can be managed to control symptoms and reduce the risk of transmissions. Sexually transmitted diseases that can be cured with antibiotics are chlamydia, gonorrhea, syphilis. Sexually transmitted diseases that can be managed with antiviral medications: chronic hepatitis, genital herpes, HIV. Untreated infections may have long-term results and are also transmitted to the partners. Proper management involves preventing further spread by tracing and treating all the partners involved. STD is well treated when you treat yourself, your sex partner, or sex partners. HIV can also be passed from mother to child during pregnancy, labor, or delivery, but the risk of transmission can be reduced if the mother takes antiretroviral drugs throughout her pregnancy and the baby received HIV medicine for several weeks after birth. Complications of STD. The longer something goes untreated, the more likely it is to cause complications. People with STD may experience complications like pain in the pelvis, pregnancy complications including miscarriage, stillbirth, and fetal anomalies, inflammation of the eye, heart and blood vessel diseases. Other complications are infertility, pelvic inflammatory diseases, cancer of the cervix, throat, rectum, and other areas due to human papillomavirus infection. Untreated chronic hepatitis B can lead to liver failure. Untreated HIV can impair the immune system's ability to fight off infections and diseases. How to protect yourself from getting STD? The most reliable way to prevent STD is to abstain from sexual activity unless with one faithful uninfected partner. Also, abstaining from all sexual contact is the only way to reduce your risk of STD to zero, but the following measures can also help. Having only one sexual partner and ensuring that the person is monogamous too. Also, proper use of condom every time you have sex greatly reduces the risk of STD. You can also get vaccinated against hepatitis B and human papilloma virus. To summarize everything, STD are infections that can be transmitted through sexual contact with an infected individual. STDs can be caused by virus, bacteria, and parasites, and some common STDs are chlamydia, gonorrhea, syphilis, and HIV. The primary risk factor for an STD is having unprotected sexual intercourse. General symptoms of STDs include discharge from the penis, vagina, itch, and blisters around the genitals. Keep in mind that you can get an STD from having sex with someone who has no symptoms and may not know they have an STD. Some STDs are curable with medical treatments, while others can be managed to control symptoms and reduce the risk of transmission. The longer STI goes untreated, the more likely it is to cause complications like infertility, pregnancy complications. Thank you for your time, and you're also welcome. Please like, comment, share, and subscribe to the channel for more educative videos.